Okay, good morning or good afternoon, everyone. My name is Joe Hook. I'm one of the trainers here at HealthCare Synergy. And the purpose for today's training is kind of to give you an overview about Healthcare Assistant and about Synergy itself, kind of giving you an idea of the new functions, services, also going into the Healthcare Assistant program and kind of identifying where everything is. And then as we go along in the months in the month of training this month, we'll go into those particulars in more detail. Okay. What I'd like to do right now is kind of go over some of the new stuff that you may or may not know within Healthcare Assistant. For example, we'll talk about Healthcare Assistant, the program itself, the difference between Healthcare Assistant and in the cloud. We'll talk about some of the new functionalities, such as being able to track patient responsibility or co-payments, where you put those amounts in, how you track those or create invoices, and then how to track those on your AR reports. Also, trying to give you an idea of where you can put in patient responsibility for, or if you are expanding your business, did you know that we have hospice capabilities, outpatient billing, and also for further billing later on, we'll go into MSP or Medicare secondary payer billing. We also have managed service capabilities, which I'll just go over just briefly. If you are interested in any of those services, again, feel free to give us a call. We'll go into further detail. Also, some of the new applications that we have coming up, such as, well, some of the new applications such as the iPhone app that we have available, and also our new upcoming web app of Healthcare Assistant. Okay. The first thing was Healthcare Assistant in the cloud. Okay. Healthcare Assistant in the cloud allows you to run Healthcare Synergy or Healthcare Assistant as you were able to do with any internet browser. It allows the IT stuff to be taken care of by our IT staff. It will be taken care of off-site. You're able to reach or to utilize Healthcare Assistant from any internet browser. You can monitor the maintenance. We will perform all the backups. And again, all this is done on the backside. You'll be able to use Healthcare Assistant just like you use, just like you use currently. However, it will be available online. If any of you have any further questions about that or would like to see that Healthcare Assistant in the cloud, again, feel free to give us a call and we'll be happy to demonstrate that or give you a further explanation of that functionality. Okay. Now, one of the new functions that are available with one of the updates is tracking patient copay. A lot of you may be taking patient HMOs or private pay or commercial pay. Some of our users have been asked to be able to track that patient responsibility. And we'll get more into this as we go into the billing section, but I just wanted to make you aware of that functionality, that you can actually report the patient's responsibility. It will actually show you on your accounts receivable where that responsibility is at. And also you'll be able to create invoices or statements that you can provide to your patients to mail off to them. So to kind of give you an example of that, we'll go into the system here. I have a patient here that is with Aetna, for example. In my claim, I've pointed out what the patient's responsibility is, and it's $50. Let's say it's just $50. Now, of course, you would want that, say that they have a deductible of $25 every visit. Of course, you would want to put the total patient's responsibility here. To track that obligation, we have certain reports, and the report I'm going to pull up specifically is the AR by claim detail report. The AR by claim detail report will tell us specifically, and I'm just going to pull it up for this one patient here. Will tell us exactly what our obligation or expected payment from our commercial insurance is, and what our expected payment from the patient obligation would be. So as you can see here, it shows us our total charges, our expected payment, and then our expected payment from our patient. Now, this is functionality has been coming up and requested a lot by a lot of our clients now because of the way the business structure is. A lot of people are taking on patients that are HMO or HMO managed. So that functionality is in there, and we'll go into more detail about this in the billing section. Okay. You're also able to print out an invoice if you need to provide to your patient, and when you print out that obligation or statement, as you can see here, it gives us a write-up of the visits that we've done and then what the patient owes. Okay. And again, we'll go into more detail as we go further along into this. Okay. Now, if you are planning on expanding your business, maybe going into hospice, doing outpatient billing, MSP billing, we do have that capability. It is part of the program. If you are looking to do hospice, we do have that functionality. To give you a little bit of a preview of hospice. Hospice billing is somewhat similar to home health. Actually, you are billing in the increments of a month period. Let me get into our hospice section here to kind of give you an idea of what it looks like. In hospice, when you're taking care of a patient, we're looking at taking care of a patient in particular what's called benefit periods. And those benefit periods are 90, 90, and 60-day periods. However, when you bill, you're billing on a monthly increment. What determines that type of bill or payment is what's called the level of care that you're providing. And in our program here, you're able to change the different levels of care. Everything from routine care, continuous care, inpatient respite, or general inpatient care. You're able to track the types of visits, anywhere from your SN visits, home health aide, volunteer, pastoral, and then you're able to create claims on a monthly basis. Everything from your 812s or 813 type of claims, your first interim claim, your continuing claim, 814 or your last claim. If it happens to be a patient that is admitted and then discharged, your 812 or 811s. If you are hospital-based, we have the 8-11s and 821s to 8-50 or 825s. So in hospice, of course, again, if you are planning on going into hospice, we just wanted to make you aware that HealthCare Assistant does have the capability of taking care of that, as well as outpatient billing. And again, if you're not familiar with these functions, don't worry. We do have, this is assuming that you're already doing these functions or businesses. We'll be happy to train your staff on how to do that. Just to also make you aware of, because of the ACO or accountable care organization models that are planning to be incorporated within the next couple of months or next couple of years, we do have other services besides the software. If you're interested in any of these services, please feel free to contact us, and we'll be happy to explain what we do for the financial accounting, payroll services, billing management. We also have Oasis quality assurance previews, PPS recovery, revenue recovery, and HIS benefits. In our financial accounting services, for example, we do have an accountant that will be willing to assist you with your Medicare cost reports, kind of sitting down and giving you an analysis on your cost per visit. Payroll services, of course, this is an online feature that will actually help you with your staff or internal payroll, billing management. That is our F1 group that will actually say that you need some temporary biller or a permanent biller. We have that capability. The Oasis Quality Assurance Review, we have clinicians that are available that provide a kind of a second eye on some of the Oasis assessments that you have submitted in. These are all tools that will help narrow down and kind of help to kind of slim down what your where you may need some help, or identify where you need some help in your internal company. We also do have available a app that's available on your iPhone. It has several functionalities. If you're interested in viewing that, if you happen to have an iPhone, just go to your applications and look for HealthCare Synergy. Some of the functionalities that you have or available, of course, is your references to your ICD-9 library information, 60 and 90-day calendars that will help you calculate those follow-up visits or calculate the episodic visits. Also, a voice recorder and mapping functionality that will help you help your field staff out in the field to identify certain, of course, help you route out to your patients. Also, allow you to do voice recordings that can be sent via email or messages to the fields or to the office staff. Okay. And then the last one I wanted to point out is our new web app. I showed you before the healthcare assistant in the cloud, which is essentially our program that you see now. We're coming up with a new web app. If you happen to use Healthcare Assistant right now or currently in the cloud, we encourage or ask our users to kind of help us with our beta testing for our web application. Again, this is going to be a all-in-one kind of solution, everything from your back office stuff to your clinical stuff. To kind of give you a preview of that, let me go ahead and go over to our, kind of give you an idea of what it looks like. As you can see here, we're developing it so that you can both be used by your field staff and by the office staff. When you log into the office side, it's going to be a completely web-based application. It's going to have a completely different look and feel. Hopefully it's a little bit user-friendly. It'll allow you to access information from a dashboard here. It gives you a little wheel here that kind of directs you as to what section or what function you want to do. If you want to view a patient list, again, you're able to access the patient's file. When you bring up a patient's file, you'll be able to dictate what needs to be done. For example, here's their intake information. You'll be able to look at what they have in the plan of care, depending on what episode you're in, doing the Oasis plan of care, and so on. And of course, on the other side of it, your field staff would be doing this documentation, and then you would be able to review it. Unlike what we have currently, where you may have a point of care service like Devaro or eClinical, the information is actually updated. It's all one database, and again, for those of you who are interested in looking at or being able to beta test this for us, we'll be happy to go through and kind of describe this in more detail. Okay, so I'm just going to log out of that, and that's pretty much covers the new stuff that we have available. I also wanted to keep you guys informed as to that we do have a Healthcare Synergy YouTube channel available. Information on there you'll find is ACO webinar that we've recently had. If you are wondering what ACOs are, there's a 3-part series that kind of describes what the ACOs are all about, and then also gives you the how-tos of certain particular functions within Healthcare Synergy. So if you were to pull up any internet browser, go onto YouTube, just kind of look for or do a search for Healthcare Synergy. You'll see, again, there's a 3-part series on ACOs that if you're interested, also giving you other items such as how to set up particular functions within Healthcare Synergy or Healthcare Assistant. Okay, so that covers pretty much all the new stuff that we have, the new functionalities. Again, if anything that you've seen so far, if you're interested, please give us a call and we'll be happy to go into more detail. I just wanted to make you aware of these functionalities. Now, as for Healthcare Assistant itself, just wanted to cover some of the details that you may or may not know about the setup and the workflow. As you can see here, I have a basic workflow of a healthcare agency. We're looking at starting off at the referral. Essentially, at the referral, you are putting in that information to Healthcare Assistant. In the meantime, you're also verifying patient eligibility. As you do that, you send out a nurse to do the initial validation. At that validation, you determine if that patient is going to be admitted. If it's not going to be admitted, you would create a not admit. If the patient is admitted, you would create an Oasis. An Oasis is then sent off and reviewed, and that's submitted to the state. Based off that assessment or Oasis, a plan of care is developed. The plan of care is then tracked and sent over to the physician for signature. Based on that plan of care, you've outlined a visit frequency. Based on that visit frequency, the patient you are then required to perform certain services, and disciplines are supposed to go out to maintain that patient's services. And then based on the services provided by your caregivers, you can provide a caregiver visit list, which can generate a payroll. That we have that functionality. Based off the services performed, you can create a claim. That claim is then reviewed, and then after the review, the claim is then submitted to your fiscal intermediary, and then the payments are posted, and then the accounts receivables are then reviewed. So each one of these represents a function that is found within Healthcare Assistant. And just to give you a brief overview, we'll start off here with the referral. So when a patient is entered in, or a referral source is entered in, you would want to click on New and actually start a patient's medical record. Okay. So instead of me starting a brand new one, what I'm going to do is pull up one that's already in the system. And again, we're going to go into more details in the next couple webinars. This is just to give you an idea of the workflow of Healthcare Assistant. Okay. When you enter in, or when a patient is first entered in, you want to create what's called their medical record. The medical record contains information such as the patient's demographics information, their insurance information, any existing notes, any communications, their case history, Ledger is the services performed, payments, adjustments, and so on. Claims information, and then financial summary information. Okay. Now, when a patient first starts out, of course, you have the basic information such as their name and address. Our next step, of course, when you have that patient entered in, I have it outlined here to verify eligibility. Of course, when you verify eligibility, you can do this one of two ways. You can actually go into the common working file of HealthCare Synergy and verify that this patient is Medicare eligible or HMO eligible or whatever the case may be. One other option that we have available is the check eligibility button within the program. Now, again, this is an additional function. If you are interested in having that capability, feel free to give us a call and we can actually give you more details about that. The functionality here for the check eligibility is good for a quick eligibility check. I still encourage for start of cares to always check in the DDE or the common working file directly. That way you can have a more detailed information about the program or about the patient's file. This eligibility check is good, so if the patient has say that the patient has multiple episodes, such as this patient here where we have reserted this patient several times, it makes a good way to check on a monthly basis. There have been scenarios or situations where you may have a patient that has changed from Medicare to Medicare Advantage in the middle of an episode, and that can disrupt your billing cycle, because once the patient becomes to Medicare Advantage, you can no longer bill Medicare traditional, and then you have to switch gears. So again, this is a good check for your initial one, but I encourage always to go for a start of care to go into the DDE or common working file. But on a monthly basis, you do want to verify patient eligibility. You may run into situations where, of course, a patient doesn't identify or inform you that they've changed from Medicare to Medicare Advantage, and this is one of those functionalities that will assist you in that. Once you have that patient into the system, of course, you want to send out a nurse to do a initial start of care visit. Of course, you would want to enter in the patient's Medicare information, and when you before you send out a caregiver to do a initial visit, you can see here that you can produce what's called an intake sheet. When we create a new in the cases file, and again, we'll go into more detail in the next couple sessions. Again, this is just a way to give you a way to identify a workflow within the system. When you send out a nurse to do the initial assessment, you may want to be able to print out an intake sheet or what we call a start of care worksheet, which will identify certain aspects of the patient's file. For example, the patient's address, if they have any diagnosis codes, any standing orders, and so on. Okay. Now, from this point on, it depends on what you're using as your field staff or your point of care. Some of our clients use a point of care option, which allows your field staff to do their paperwork online, or you may be at the stage where you're doing everything in paper format, and that's fine too. In our next step here, the Oasis input is all based on how your field staff is doing their documentation. If they're doing their documentation all on paper, all it's necessary to do is to enter in this information manually. So when a nurse comes back from the field staff or from the field, they may have documentation that looks somewhat similar to what we have here. And this is called the Start of Care Oasis. You may have the Briggs forms, the MediPass forms, or whatever documentation that you use to assess the patient's situation. So if you're using the Briggs forms or the Medipass forms, or even if you're using the forms currently available in the system, this information would need to be manually entered in. So here are my, of course, my nurse would go out and fill out the proper information. So what we would want to do, or what you would have somebody do internally, is enter in the information, such as these MOO questions, and enter that into the system. So we use what's called status records that identify, first off, what our first episode period is. We identify the information that we need, such as the Oasis and the plan of care. And then based on other information, as we put in the Oasis, it will calculate our HHRG, our PPS, and so on. Okay. If you are utilizing what's called the point of care system, our electronic point of care system, the information, instead of being put in manually, it is actually brought in by matter of reviewing that information. And again, all depends on how you are set up. And of course, this information that I showed you that we're doing manually can be brought in automatically and then brought into the system. And again, we'll go into that in more detail later on as we go into these functionalities. The point of care, again, this can be entered in manually based on the information given to you by your caregivers. If you're using a point of care, electronic point of care system, that information is entered in automatically or brought into the system. Scheduling, all again, depending on how you schedule, you are able to create patient schedules. Right now, let's take a look at a current patient here. Now, a patient schedule can, depending on how you want to set it up, you can set it up so that you establish on the plan of care a visit frequency. Say that we want to establish a visit frequency of 1 week 9, one visit a week for 9 weeks. And here I want to make that 1 visit a week for 9 weeks. And again, don't worry about how to do this yet. Again, we'll go into this in more detail as we go into scheduling. I just wanted to make you, again, aware of the functionalities and the abilities that the program has if you're not aware of it already. Okay. Okay, so here we've established that we projected 9 visits. We can schedule for 9 visits. It'll give us any warnings if we happen to overlap our visits. If I mistakenly take a visit and put it in the wrong week, again, compliancy is a major issue. It's an ongoing issue within the healthcare industry. We just want to assist you with making sure that your nurses are being able to comply with the visit frequency stated in the plan of care. Okay. So that's, again, the functionalities within the plan of care, the scheduling. As each visit is completed, you're able to post each visit. Posting meaning that the visit has been confirmed and those visits are ready to be billed. In the posting process, there are several ways to post for a patient's visit. Actually here, this is a scheduled visit. All I'm doing is then confirming the actual in and out times. If you have the notes in, And then going on to the next visit, maybe, for example, that this visit was a training education visit or a supervisory visit. Again, all you're doing is confirming the visit that was completed based on the scheduled visit. And we can move this to any particular time. Maybe the visit done on 11/25 was actually done on the 26th. And again, we'll go into this in more detail. I just wanted to, again, make sure that you're aware of the functionalities within the system. Okay. Now, with each visit confirmed or done, the program has a capability that you can actually create what's called a payroll sheet, giving you a estimated amount of based on a patient's or based on the rates that you give your caregivers, based on also what type of visit. Again, we'll go into more detail. As you can see here, we can assign different rates based on the type of visit, if it's a direct care visit versus a revaluation visit or a eval visit. And again, we'll go into more detail for payroll at a later time. And then the last couple steps here, being able to create wraps and finals, reviewing those wraps and finals. Within HealthCare Assistant at the top here, you'll notice that you have a claims list availability. Under your claims list, you're able to review claims that are created not just for Medicare, but for commercial insurance as well, giving you other information as to what type of claim form it is, if it's been sent or not, the amounts, and their payments. Okay. Okay. Now, as for a schedule as to when we're going to be talking about this, if you have gone to our website before, simply go to our webinars. And this one was just a review or overview of HealthCare Assistant and its programs. Our next webinar will be next Wednesday, in which we'll go over the basics. I'll show you how to actually go and cover how to enter in a patient, how to create their plan of care, how to do the Oasis assessment, the diagnosis codes and libraries, and an introduction to their scheduler, and then some of the reports that you would find available as well. So again, I just wanted to make sure that that you're aware of some of our functionalities, some of our new functions, what we have available, go over a brief overview of HealthCare Assistant, and then our overview of the workflow of a agency. And at this time, I'll be happy to go over any questions that you may have. If you happen to have a question, please feel free to type that question out. If you don't have a question now, please feel free to give us a call. I'll be happy to go into more detail, especially if you have a specific question that's pertaining to your agency. I understand that some questions that you may have may be particular to a specific function, so I have no problem going over with you on that. If not, again, we will, on Wednesday of next week, we'll go over the basic intake, and then we can go into more details. Okay. Well, there doesn't seem to be any questions. If there was any questions on any of the other functions or items that I had shown earlier, please feel free to give us a call if you're interested in any of our managed services, any of the tracking amounts for co-payments, the new modules, our web app, anything such as that. Please give us a call. We'll be happy to go into more details. But this is just more of a way to give our clients a awareness of what we have out there and to enhance what they currently have. Okay. Well, thank you very much, everyone, for your attention. Again, if you have any questions, please feel free to give us a call at HealthCare Synergy, and we'll be happy to assist you. Well, thank you, and have a nice day.